My name is Lisa Cahey Stevens. My title is Director of Oncology at Landmark Medical Center. Landmark's mission statement is to provide state-of-the-art care in a community environment, so an at-home environment. So we provide care to patients and their families at a smaller community center. So it's great care close to home. I did learn a lot today. Financial toxicity in a cancer patient, it's such a real thing, and we see it every day with our patients. So it was nice to be here at the summit and listen to so many people talk and give different takes on things. And it made me realize, we go at it at our local level, with the patient, with pharmaceutical companies, things like that. But just made me realize I need to broaden that to be talking to lawmakers more and to see what we can do on a larger scale, because it's not just our problem, it's a problem all over the country. The summit offers such relatable topics. I mean, it's just everything talked about today is something that I see every day in our small community practice. So it's always nice to come and to hear from people who do this every day and get other people's takes on how they address the same issues that we're all having, but it brings a different take on it. So it's nice. The partnership in general, not just my experience today, it's just so patient focused, and they do so much for our community. We have done COVID kits. You guys have supplied us with dental kits. There's so many things that are just, like I said, relatable to our patients. So we take a lot away from everything the partnership shares with us, but it's a wonderful organization to be a part of.
Donna MacDonald, Registered Nurse Case Manager for the Program in Women's Oncology. So Women and Infants is a premier facility caring for women and infants, but in particular, we have the Program in Women's Oncology that cares for women with breast cancer and gynecologic cancers, not only in Rhode Island, but in southeastern New England. So today enhanced my knowledge greatly on the side effect of cancer, which is financial toxicity. We talk about many side effects that we have good treatments for. And today I learned some new avenues in assessing and implementing some activities to take care of some of the financial toxicity for our patients. I think one of the major things that the summit that we hold here every year is interdisciplinary and patients. So I was stopped by a number of patients asking me questions. And also I've gotten to be with some social workers, physicians, you name it, nurse practitioners. It's very interdisciplinary, and it focuses on many levels of care. So for those colleagues who didn't come, I'm going to have them watch it on the partnership's website, because there was some vital information. I thought our keynote speaker was phenomenal. I can't wait to watch that movie. So we'll be promoting that among my colleagues, not only at Women and Infants, but through the Oncology Nursing Society.
So yeah, my name's Eric Lammy, and I am a board member at the Rhode Island Public Health Association. So the mission of the Rhode Island Public Health Association is to promote public health practice and the dissemination of public health information to communities, to empower them to make better decisions about their health and to live healthier lives. One thing that I thought was really important about the discussion today, and of personal interest to me, is bringing health economics into the discussion, because a big part of what the Public Health Association does, both nationally and locally with our Rhode Island chapter, is to advocate for better public health practices and information. So I think when it comes to advocacy and talking to legislators and stuff like that, I really think that we need to incorporate health economics into this discussion a lot more, because at the end of the day, if we're asking for money, we need to be able to show a return on investment. So this is the kind of information that I don't think is very widely available to public, and they don't entirely have all this information at hand. So I think creating resources and hosting events like you all did today to share this information with the public is really important. Well, personally, I love this summit because I get to meet with other folks in Rhode Island who are working in the same area and who are also really passionate about getting this work done. I think what ends up happening a lot of the times is we all get funding from these different sources and we're working towards the same goal, but not working together. And I think there's a lot of room for improvement when it comes to integrating our efforts. And, conferences like this and this one in particular has always resulted in me, making connections with folks I didn't know and being able to better serve Rhode Islanders as a result of that. I am a big advocate of the partnership all the time. So today I will tell them that it was a great conference, that I made some really good connections. I'm going to be reaching out to those folks in the next few days and setting up meetings with them. And I will encourage folks to visit the partnership's website, to visit the Public Health Association's website, and to look at our partnership over the next year. So folks might not know, but the Public Health Association just contracted with the Partnership to Reduce Cancer, and we're going to be doing a lot of integrated work around sort of promotion of cancer prevention information.